COVID-19 fears are sending prices skyrocketing for some healthcare products, and they're raising concerns about price gouging.
Would you believe 16 ounces of hand sanitizer was going for more than $100 online today? We sent KOMO's Michelle Esteban out to find out what you can do about this. She's live outside Costco in Shoreline. And Michelle, I'm guessing that place has been a zoo as people try to stock up.
The word I kept hearing over and over again today, Molly, was crazy, and you're going to hear it from the people that we talked to. Online shoppers that I talked to today tell me they're really feeling as though they're being taken advantage of. And part of the issue is shoppers who are trying to find some of these basic items, these healthcare items, as well as basic essentials, are finding when they go to some of the stores, they're gone.
And everybody's going crazy in there.
Oh, it was crazy busy, really packed. Yeah, lines were looping around to get out.
Everybody's worried.
Shoppers are stockpiling, but not finding everything they want. Photos taken by a shopper inside this Shoreline Costco on Sunday show empty shelves, hand sanitizers, disinfecting wipes, even fresh chicken gone.
Pretty much out.
Still no chicken today, no bottled water, no flour, and no rice.
They're out of toilet paper and paper towels.
There's no way in the moment, to force someone to lower their price. So, that's going to be about figuring out what the best decision is, for you and your family in the moment.
This Assistant Attorney General is talking about this apparent price gouging online for products relative to COVID-19. She says the Washington Consumer Protection Act shields consumers from unfair pricing, but on a case-by-case basis. She says if you want to file a complaint, do it, and their office will investigate. Despite Amazon's fair pricing policy, we did find some really high prices, particularly on hand sanitizer. 2 of these are going for $114. These guys, these handy wipes, 80 of them, $41.43. And these N95 masks, sold out, unavailable. In this statement, Amazon said there's no room for price gouging on its site, has a policy against it, and has recently removed tens of thousands of offers, and is taking action against third-party sellers who violate the policy.
If you really want to get rid of germs on your hands, a simple pass of soap and water doesn't cut it. Dr. Paul Pottinger directs the Infectious Diseases Clinic at UW Medicine. Here's how the medical pros do it.
We always start by getting the hands wet. You don't want to apply soap to dry hands.
Wet your hands first, then lather up. And here's where a lot of us drop the ball. Don't just wash your palms.
Because there's other parts of the hands where the germs can hide. The backs are classic. You really want to get between the fingers.
From the time we start sudsing, we should spend a minimum of 20 seconds, about the time it takes to sing our ABCs.
Really getting that soap all over the hands. So finger to finger, back to front, front to back, and then you gotta pay attention to the thumb. The thumb does a lot of work. It's neglected, and it's a part of the hand washing cycle that sometimes people forget. And then I'll start in the middle and really try to get my fingertips. That's another place that can be tough to get if you're just rubbing your hands. So I rub my fingers in a little spot like that on my palms, and that's been about 20 seconds.
It was actually 29.
And if you have to use your hand to turn off the water, use that towel to do that so you don't recontaminate your hands when you're shutting it off.
And to prevent picking up new germs, skip the handshakes. Go with the fist bump, or the doc's preference, the air fist bump. Even better, bump elbows instead.
Nice.
And again, the key areas most of us miss are the backs of our hands, our thumbs, and especially our fingertips, which spread all those germs when we touch our eyes and our noses and our mouths.
Right now, King County Metro Transit is executing a plan that they hope will help keep passengers safe as we see more cases of coronavirus emerging across the region. KOMO's Kara Kostanich is live in Seattle with the very latest. And Kara, it's a real concern with so many people riding the Metro buses.
That's right, Eric. And here's a daunting number, 128.3 million. That's how many people used bus, water, taxi, van, and more right here in King County in 2019. That is one critical reason why Metro is upgrading their cleaning protocols as we face this potential problem here in our community.
On any given day, more than 400,000 passengers board 1,500 Metro King County buses across the county. Kevin Allen is one of those passengers.
Usually my bus is really packed, but not today.
It's not yet clear if ridership has been impacted by the worry of coronavirus spreading around our community.
Taking any extra measures on the bus?
I hadn't been.
I might now.
Today, Metro showed us how they clean their buses from top to bottom every month.
And we're looking at expanding or increasing the clean rate.
That means more cleaning in what Metro calls people touch places.
I have a few teams right now that are meeting as we speak in discussion about how the process could be modified to improve it.
Metro says they're working with public health to make sure they're cleaning enough and using the right cleaning products to kill the virus, not only on Metro buses, but all public transportation across the city, including light rail, water taxi, streetcars, and more.
I want to know what the public health people think about that and whether it will actually help.
The agency says they hope to have the new cleaning protocols in place by tomorrow.
Anything you can say to ensure passenger safety out there during all this?
I would say our operators and our customers, I care about both. Let's all do our part. Good hygiene, good cleanliness is going to be a key to the health.
Concerns will mean no classes again tomorrow for several schools in the area.
And one district is taking it a step further, closing all of its schools tomorrow for training just in case the virus spreads. KOMO's Steve McCarron is live in Bothell at one of the schools being cleaned tonight. Steve?
Yeah, Eric, crews have been cleaning Frank Love Elementary School here after a staff member recently came down with flu-like symptoms. That staff member is now being quarantined and tested for COVID-19 or the coronavirus. And district administrators hope to have the results of that test back sometime soon. Tomorrow, North Shore School District's superintendent will close this school again, along with every other school in the district. That's so staff can be trained on ways to teach students outside the classroom if that becomes necessary in the coming days. District staff will also come up with a plan to disinfect or deep clean every school, not just the campuses where issues have been raised. During a news conference today with state and county health officials, several of them told us school closures are not necessary right now, but districts have every right to close their schools for cleaning out of an abundance of caution.
Based on the level of disease in our community now, we're not recommending widespread cancellations of gatherings or closures of schools. But we do want people to know that this infection is with us and it's going to be increasing.